A Catholic hospital in Canada is under fire for giving a prominent role to an assisted suicide provider. Providence Hospital in Ontario named the euthanasia supporter and practitioner as interim director of palliative care. A variety of professional associations, including the Canadian Federation of Catholic Physicians, asked hospital and church officials to intervene. The Catholic Church strongly opposes assisted suicide. We go now to Alex Schadenberg, Executive Director of the Euthanasia Prevention Coalition. He is based in Canada. Alex, great to be with you again. First off, what more do we know about Dr. Danielle Kain? And we know her appointment is really causing a lot of concern over there, especially among the Canadian Federation of Catholic Physicians.
Yeah. Well, she's not only a euthanasia provider, so she's not only been involved with killing her patients, she's also been published on several occasions, and she's been pretty committed to this. So this is why it's such a great concern. But also the fact that the euthanasia lobby has been pushing so hard to try and force Catholic healthcare to be involved with euthanasia, participate in euthanasia. And now to do this really undermines the fact that the Catholic Church has been holding the line on this.
Yeah, and her title is the Interim Director of Palliative Care.
That's right.
Talk to us more about that job. And also, you know, why having an assisted suicide supporter and practitioner? I mean, we know that goes against church teaching, so why would they do it?
I think that you have people who are in charge of hospitals that are not necessarily thinking of the Catholic faith per se. They're bureaucrats, etc. It puts the church in a very bad position because the Archdiocese of Kingston, this is Kingston where this is happening, is not exactly like the Archbishop is actually a pretty good guy, actually. So this is not something you would have expected to have happen, but he's certainly being put in a bad place, and hopefully he does the right thing. And there's nothing easy about this situation. But you have to understand the real problem with this is that recently Quebec passed a bill which is going to force all palliative care institutions in the province of Quebec to provide euthanasia. And I was recently speaking to a doctor in Quebec, and they're working on a court case because there's a couple of, faith-based Catholic palliative care institutions in Quebec who are really upset that this is taking away their rights because they're being forced to participate in killing. Recently in Vancouver, the St. Paul's Hospital has had a big situation because the euthanasia lobby is pushing St. Paul's to be directly involved with euthanasia. And of course, they're refusing. So what happened is a few months ago, one of their patients who was in palliative care had asked for euthanasia, and of course they refused, but then they transferred that patient out of the Catholic hospital, and now that family is making a big deal of it, and the euthanasia lobby is pressuring the British Columbia government to force St. Paul's to be part of euthanasia. And at the moment they haven't been forced, but you see this pressure, and then Kingston now hires a euthanasia doctor to be head of palliative care. You realize right off the bat that this is not a good thing. First of all, it's not a good thing anyway, but on top of it, you can see how all this political pressure could lead to something in a very bad way.
Yeah, I was just going to say that. I mean, where does this all go?
Yeah, that's exactly it. I would hope that Dr. Danielle Kain doesn't do something that undermines the hospital's position. But, the problem is a lot of these decisions are made behind closed doors. You can't have a killer involved with palliative care in a Catholic hospital. You just can't. What they do outside of the hospital, I guess you can't control in any way. But within the hospital, you can't have them have positions like that, because how can you trust someone who's willing to kill their patient?
Yeah, it really kind of boggles the mind there, Alex. Curious, what else you're following? Anything else going on in Canada or overseas?
Well, right now there's a lot of issues in Canada related to euthanasia for poverty, euthanasia for people who are homeless. But the whole issue of euthanasia for mental illness is really big right now because of the fact that Bill C-314 will have its second hour debate on October 3rd. That's the bill to prevent euthanasia for mental illness. And it's a private member's bill. So if that were to pass, that would obviously give us great hope. But on top of it, right now, the government has scheduled March 17th of 2024 to allow euthanasia for mental illness alone, meaning you wouldn't have to not have a terminal condition, you could have a chronic mental health condition, and you would be able to be killed by euthanasia. Now, I know they do that in the Netherlands and Belgium already, but our rules be far wider. And this is very scary considering the number of people going through mental health issues that, sometimes you feel like your life lacks meaning, purpose, or value, and you might ask to have your life ended. You can't allow this in any way, shape, or form for people, especially in these very vulnerable situations.
Absolutely. We've got to pray about it. Alex, thank you so much for being with us. Always appreciate it.